started. I want to say welcome to everybody. Thank you for joining us. This is the Henry Ford Health System COVID update. Our speaker today and guest is Dr. Adnan Munkarah, Executive Vice President, Chief Clinical Officer for Henry Ford Health System. Thank you for joining us, Dr. Munkarah.
Thank you, Tammy, and good afternoon, everyone. And I hope all of you have been staying safe and well. Over the next few minutes, I'm going to share with you some updates on our COVID situation, and we'll be happy to take some questions at the end of this briefing. First, with respect to our COVID numbers and COVID status, unfortunately, as many of you are aware, in the past 24 hours, we've seen one of the highest numbers of new COVID cases around the nation. We've exceeded 100,000 cases in the past 24 hours, and the state has exceeded 4,000 cases. Definitely an alarming sign of what is facing us over the next few weeks. What we have also seen is that while in the spring of 2020, most of the surge in our state happened in Southeast Michigan, not exclusively, but most of it, we are seeing a significant surge now across the state. So it is definitely taxing all healthcare systems and hospitals across the state. We have also seen a commensurate increase in the number of positive testing that we are seeing in our institution. So in the past 24 hours, the test positivity rate was 12% among 2,000 tests that we have performed. And this is definitely a significant increase from numbers that we have seen a few weeks ago where we were in the low single-digit number. When we look at the number of our patients who come to the emergency departments at Henry Ford Health System who have some symptoms and are testing positive, we are up to 25%. Again, a significant increase from single-digit numbers that we have seen before. With respect to patients admitted to the hospital, the number of people with COVID admitted to the hospitals across the state in the past 24 hours exceeded 2,000. They were about 2,300. At Hanford Health System, we had 250 cases that are COVID positive or COVID suspected and are under what we label as droplet isolation. This means that we are putting in situations where we are very suspicious that they have COVID and that we don't want to expose others to the possibility of transmitting that virus. But out of these 250, 200 are definitely testing positive. So we are definitely seeing a trend of increased cases in the community, but this is also being reflected in the number of patients admitted to the hospital. And we continue to monitor that very, very closely going forward and connecting with other healthcare systems as well as the Michigan Department of Health so that we are coordinating our efforts with this surge that we are seeing. The next topic I wanted to talk a little bit and share data about is influenza. As you know, we are hitting now the influenza season, and the question, are we going to be hit by both the flu season and COVID? Fortunately, there has only been 12 influenza-like illnesses statewide in the past few weeks that have been reported. And we've not seen any flu cases that have been admitted to our hospitals at the present time. The positivity and visit rates that we have seen for the flu has been lower than what we usually see during this season. So we are at least optimistic that hopefully we'll not have another surge of a flu along with COVID. But what is very important to remember is that the mitigation measures that have helped us control COVID will help us control the flu. So masking, social distancing, avoiding gatherings, large group gatherings, and hand hygiene can protect us from both COVID as well as the flu. And at a time where our medical resources and health resources are significantly strained because of this huge pandemic that we have faced now in the past few months, it is extremely important for all of us to take all the measures possible to prevent the spread of the flu and of COVID. With respect to our personal protective equipment, this is something that has been a significant strain in the spring of 2020. We continue to have a inventory of PPE that will help us over the next 100 days with respect to masks and as well as face shields and eye protection. We continue to monitor this very, very closely to make sure that we are able to provide both our staff as well as our patients and their families with the protection that they need. We have also switched now to using reusable gowns in many of our institutions. So we have, as we have shared with you before, that we have gowns that we can use multiple times, and we have switched to that so that we can continue to preserve our personal protective equipment for the safety of all. From an operational and preparation perspective, we have reactivated our System Incident Command Center about a couple of weeks ago. And we continue to have that active, and now they are meeting twice a week. We also have a steering executive committee that meets an additional twice a week so that we are coordinating our efforts throughout our system. And the reason we have decided to do that is we want to have very close monitoring of the situation as it emerges, as well as to make sure that we are prepared to make rapid changes as needed to accommodate the increasing number of patients. We continue also to focus very closely to make sure we continue to provide care to our COVID as well as our non-COVID patients. Things that we have learned during the last surge, that many of our non-COVID patients decided to delay care. And this was not good because people end up delaying care for cancer, for cardiac problem, for strokes, and this has impacted their wellness as well as their health and left them in situations where their outcomes were compromised. We definitely want to take every single step and measure to make sure that we continue to provide the care for the COVID and non-COVID patients. If we've not changed at the present time or delayed or postponed any of the care that is scheduled, and if we decide to do that, we'll make sure that we will reschedule or postpone things that are the least time sensitive or things that are not time sensitive as the first stage or first phase of those delays. We are also looking at our visitor policy at the present time. We have adopted, like many other healthcare systems, is very strict visitor policy during the surge. We continue to limit the number of visitors that we have, and we are revisiting this. We at Henry Ford Health System, as well as other health systems, coordinating to make sure that we are all aligned in that aspect. The idea behind it is to try to prevent, again, the spread of disease by exposing many people to the risks of being around infected people or people who are carrying the virus and accordingly cause more harm. Even with our current visitor policy, we continue to stick and to abide and require all our visitors to be wearing, as well as our team members, to be wearing masks. And we are also following our social distancing guidelines that we have adopted and continue to be very compliant with and monitoring. So even in our waiting areas or waiting rooms, there are very strict social distancing policies, and we continue to streamline the flow of our patients and the families through our ambulatory centers. With respect to testing, we have adopted a very liberal aspect to testing in the past few months and continue to do that. We are currently testing all our inpatients, whether they are suspected to have COVID or not. So all our patients admitted to the hospital are tested at the present time. We've been and continue to test all people who are undergoing procedures before they undergo those procedures. We are testing all pregnant women who come in to have a baby, whether they are in active labor or have a scheduled induction of labor or scheduled for a cesarean section. And we are also testing any person who screens positive who are coming to our labor and delivery room for being monitored, even if they are not admitted. So we are taking every single precaution that we can and that's available to us, understanding that testing is not a full safety precaution or it is not 100% protective, but we are taking everything that we can do to mitigate the risks that we have from exposing people. With respect to some of the things that we are doing at the present time on the prevention side, in addition to the mitigation risks, mitigation guidelines that we are using at the present time and mitigation procedures. We are very excited to share that we are going to be another site for the Johnson & Johnson vaccine trial. As many of you may know that we were part of the Moderna vaccine trial a few months ago, and we have completed accrual in that trial. Now we opened another trial, which is for another very promising vaccine, and this is starting accrual within the next few days, and information related to that is available on our website. We also are part of a monoclonal antibody trial by Lilly's. This is another intervention for people who have the coronavirus and are experiencing some problems and symptoms related to that. And last but not least, we continue to provide remdesivir under the emergency utilization authorization, emergency use authorization, as well as on clinical trials. With respect to the vaccines also, we continue to be optimistic about having one or two vaccines that will show efficacy and effectiveness in the next few weeks. We are working very closely with the Department of Health at the state of Michigan to coordinate the allocation, the distribution of those vaccines, to prepare ourselves that we can store them and we can deploy them to the individuals who will be candidate for these vaccines. We know that the first phase of vaccine distribution as well as inoculation is going to be for a certain group of individuals that the CDC as well as the FDA will be sharing with us. And we've had some of these preliminary guidance, and we have been working internally to prepare for that, and we feel that we are in a good place. Until we know which vaccine will be going out first and what are the number of vials that we'll be getting and what are the number of doses, we cannot finalize these plans, but at least we've started significant amount of groundwork so that we are as prepared as we can when a vaccine is approved and where that vaccine becomes available for us to use. So we continue to work very, very hard to make sure that we are monitoring the situation closely. Not only that, we continue to provide the care that our patients need at the present time. The good part that although we have seen an increased number of patients coming into the hospitals, it is not the same numbers that we have seen a few months ago. Many of them are still requiring being in intensive care units. So about 18 to 20% of patients who are coming into the hospital are being in the intensive care units. But the percentage of people who are going on ventilators, who are placed on artificial respiration, is much less than we have seen before. And part of this is because we've learned much more about the disease over the past few months and how to manage it differently, where we do not feel that we need to put people on respirators or ventilators too early. I'm going to stop here and I'm happy to take questions.
Thank you, Dr. Munkarah. Our first question comes from Paula Pesci. Paula, I'm going to unmute you if you could ask your question.
Sure. Can you hear me?
Yes, we can. Thank you.
Hi, Doctor. I was just wondering, with the current rise in cases and Thanksgiving a few weeks away, what do you recommend for families to celebrate Thanksgiving? And is it safe to have out-of-state relatives come in and celebrate with the families?
And
Thanks, Paula, for the question. Paula, I know these are very difficult times, and these are the very difficult situations to share, because many people at the present time are looking forward to the holiday season, the Thanksgiving and other holidays that will be coming in December, and people celebrate usually as a family. The concern that we are seeing with this virus, and as you've seen from the numbers, that the spread has been really very concerning over the past few weeks. And what is happening, we know that this virus can be present in people even if they are not exhibiting symptoms, and they can transmit that virus even when they are not exhibiting symptoms. So our advice at the present time to people to celebrate virtually this year. We know it is not the same. We know it is tough. We know it is emotional. But honestly, for the safety of everyone, the more we are able to protect people, the better off we are. And our concern is that while the younger population might not have the same acuity of the illness as the older population or the more vulnerable population. When we are gathering for family occasions, when we are gathering for holidays, what's going to happen? We are going to expose our loved ones, our loved grandfather, our loved grandmother, great aunt, or some of our family members who might have illnesses that put them at high risk of the disease. So as hard as it is for a decision, I really recommend and suggest to people to limit gatherings, even if you say, well, this is a family member, because we don't know who is carrying the virus today. We know that this virus has spread significantly in the community. The numbers reflect that, and we need to be careful to avoid having any significant surge of people who can get very, very sick from that virus and die from it, lose their lives to it.
Thank you, Dr. Munkarah. And Paula's with the Oakland Press. Those that I introduced, could you please say what outlet you're with? And Dr. Munkarah, we have our next question from Kristen Seamus.
Hi, Dr. Munkarah. I'm Kristen Seamus from the Detroit Free Press, and I'm wondering about whether the hospital system is considering at all restricting the number of elective procedures, or is going to limit anything that it's offering to patients in terms of medical services right now because of the rising COVID-19 hospitalizations.
Thank you, Kristen, for your question. We just, in fact, literally an hour ago, I just finished a meeting discussing that topic specifically with our operation leader, but also with our clinical leaders, with our chief medical officer across all our hospitals and the chief executive officer of our medical group. We feel that at the present time, we are not in a situation where we need to restrict the number of cases or postpone any care for non-COVID related patients. We are going to continue to monitor things very, very closely, but currently we are continuing to provide all the care that has been scheduled or that is needed for our non-COVID patients.
Thank you, Dr. Munkarah. Our next question comes from Karen Bouffard. Karen?
Yes, hi. On the monoclonal antibodies, I'm wondering which company's trial you're participating in, and if you could tell me a little bit about that trial. Thank you.
So we are participating on the Lilly's monoclonal antibody candidate at the present time to treat COVID-19 patients. I don't have all the details at the present time, what we call the inclusion criteria in front of me, but happy to share it with you, Karen, afterwards. We can share it with you, once I have access to all these criteria.
Thank you.
And Karen's with the Detroit News. Next we have Jay Green.
Hi, Dr. Munkarah. It's Jay Green at Crane's Detroit Business. You mentioned you've got 200 positive COVID patients. How many of those are in the ICUs? And can you talk about if they're sicker than those ICU patients you had in the spring? I read and reported on some studies that show that the patients with COVID this fall have less viral load, and that leading to some patients who are less sick. So I'm wondering if you've seen that in your patients.
So Jay, I'm going to first, just if you give me a second, I'll be able to tell you where we are with respect to our numbers with respect to the patients in the ICU. So as far as your question regarding the how sick are the patients that we are looking at the present time, the people who are in the ICU are sick. I mean, they are acutely ill, and it is, I would not say they are less sick than the patient that we have taken care before. And I'm familiar with some of the data saying we are looking at a lower viral load. We do not have any evidence that this is the situation that we are dealing with. As I had mentioned before, we have less patients who are going at the present time on ventilators because we have learned that our approach to put people early on ventilators in the past have not been the right approach. And the reality is that, and that approach was adopted based on some evidence that we got at that time from China and other places around the world that were treating COVID patients. But we've learned fast that this is not the right approach, and we've adopted other interventions that are aggressive interventions with use of steroids, use of medication to help widen the windpipes in order for people to breathe better, turning them around without having to put them on ventilators. So the patients in the ICU have continued to be a relatively sick group of patients, as I've mentioned. With respect to your question, I just pulled our number. We have 52 COVID-19 patients who are in our ICUs at the present time. So very similar to the number that we've had before with respect to percentage. The number of people who are on ventilators, however, is significantly lower. We only have 20 patients on ventilator out of the 200 plus, so less than 10% of patients are on ventilators, significantly lower than we had before.
Thank you, Dr. Munkarah. We also included a link to the Lilly trial in the chat if anybody would like to see background information. Karen, I can send it to you directly through email. Our next question comes from Amy Lang. Amy?
Hi there. Hi, Tammy. Hi, Doctor. Great to see you. Amy Lang from Fox 2. Just wondering, can you give us an idea of your concerns about capacity? I mean, you're talking about all, the surge, clearly all these numbers that we're experiencing in terms of positive test rates. What looking forward, it sounds like you're, okay, but how concerned are you about being able to treat the number of patients that could be coming?
Thanks, Amy, for your question. And honestly, for all of us, this is a significant concern. The most important thing for us is what are the measures we can take at the present time to prevent that virus from causing the same harm that it has caused in the spring. We've done predictive models similar to what other systems have done, and we do believe that we are going to see an increase in the number of admissions over the next few weeks, and we will continue to monitor our capacity closely in that respect. We are hoping that if we are continue to comply with the measures that we know have helped us level the infection rates before, that have helped us bring down the surge that we have seen in the spring, that this will help us maintain our capacity to be able to manage not only the COVID, but also the non-COVID patients. And this is why really we've been advocating, strongly recommending that things that are relatively simple, the masking, the hand hygiene, the social distancing, we know that these have helped us in the spring. And if we can use them now, we are able to level and to flatten that curve that is increasing with respect to the admissions. So I think we have a way forward on that. I really believe that between that, if we take these measures and hopefully have a vaccine soon.
Sorry about that.
And if we have the vaccine at hopefully coming up in the next few weeks or a couple of months, that we have a way forward. But we really need to be very strict. We need to be all part of the solution. This is not only the hospitals or the doctors. All of us as a community can mitigate that risk and bring the numbers down.
Thank you, Dr. Munkarah. Our next question comes from Dan Zakara.
Hi, Dr. Munkarah. Dan Zakara from Channel 7. Thanks for your time today, sir. Appreciate it. Just to clarify a point and then a question, you mentioned at the beginning of your comments, 2,300 people approximately were admitted in the past 24 hours. Is that the Henry Ford Health System or is that across the state?
No, Dan, just to clarify, what I mentioned regarding the hospitalization is across the state. These are not admitted in the past 24 hours. These are COVID patients who are currently in the hospitals across the state, the number of hospitalization related to COVID.
So 2,300 statewide in the hospital currently in the last 24 hours.
This is the last number, yes. So not all of them got admitted in the last 24 hours. All of them are sitting in the hospital in the past 24 hours.
Okay, thank you. And you mentioned in how you've been in communication with the other health systems. Can you give us a perspective on what you're hearing from the regional health systems here, but also across the state, and how this is not just a regional concern now, that it's a statewide concern, and what's being done potentially to, with your communication with the state health department to encourage, what needs to happen next to try to stem this? Because we're seeing that exponential growth again that we saw in the spring of just case numbers going up pretty significantly over just a couple of weeks.
So, thanks, Dan, for your question. With respect to the communication that we are having with other healthcare systems, we are seeing a surge at the present time that's across the state. So talking to our colleagues at Spectrum, well, their numbers were much lower in the past spring. They are seeing a significant increase now. The same in Lansing, the same in Saginaw. In addition to many of our many colleagues who are in northern and smaller hospital, Munson in Traverse City, big hospital, they've been really flooded with cases in the past few weeks. So we are seeing this across the state, and we are trying to come up with kind of models to kind of say, from a care perspective as well as transfer of care, how can we help each other? How can we educate each other? Places that have not taken care of enough patients in the past, what are the things we have learned and what are the lessons that we can share with them in that respect? I can tell you that one of our biggest concerns across the state at the present time is our staff shortage. We have, all of us feel that the PPE we are covered as PPE. The reason we are concerned about staff shortage is because of the exposure of the staff to COVID in the community. So we are we are facing a lot of people who are out in the community being exposed to COVID and accordingly sometimes being quarantined or called by the Department of Health to be quarantined, or people who are turning positive because of their exposure in the community. And this is why, and to me, when we talked about capacity, and Amy asked the question earlier, my concern about the capacity, honestly, if we are not able to control that spread in the community, is whether we are going to have enough staff to take care of the patients who are in the hospital. The other problem that is also very important for us is that now we are facing this at a national level. In the spring, there are other states and other healthcare systems from around the nation who were able to help us by sending some staff, sending some nurses. Small numbers, but they were helpful to kind of relieve the stress and the pressure that we had. At the present time, everybody is facing the same problem. And this is why, if we are not very, very adamant in implementing these guidelines, complying with the measures that we've talked about, the masking, the social distancing, we are going to have issues. We are not going to have enough staff who are going to be able to take care of patients within the hospitals.
Thank you, Dr. Munkarah.